Good morning, everyone. Thank you for joining us on this beautiful Thursday morning. My name is Sam Peck. I'm the Executive Director of Family Councils of Ontario, and I am one of your co-hosts for this morning's webinar. We're going to give folks a couple minutes to start filtering in. I see we've already got over 300 people who have logged in to this morning's session. I think it's a very strong indication that this is an important topic to families and residents alike. So it is my pleasure to be doing the opening remarks along with my colleague at the Ontario Association of Residents Councils, Melissa McVie. So today is a really important opportunity for you to hear directly from Ministry of Long-Term Care about the Fixing Long-Term Care Act of 2021. So today's webinar is an overview of the Fixing Long-Term Care Act, and it is specifically for residents, families, and caregivers. And now over to Melissa.
Thanks, Sam. A pleasure to be here and to be co-presenting with you as well. This new legislation is very special, as you've indicated. It's a very substantial change, probably the most substantial change we've seen in over a decade. And this new legislation is coming into force next week, as early as Monday. So this really represents a key milestone on our journey to transformative change in long-term care. And we know this will have a profound and direct impact on people that live in long-term care, their teams, and their supportive partners and loved ones. So we are so grateful for this opportunity to learn more about this incoming act. And undoubtedly, today's conversation will spur on lots of interest for future education and discussion.
Thank you, Melissa. Before we get into more of today's content, I'd like to take a moment to acknowledge the land on which we're meeting today. FCO was founded on land Toronto. That's the traditional territory of nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples. And like communities all across Ontario, it's still home to many diverse First Nations, Inuit, and Métis people. FCO and OARC are both remote teams, and today we're meeting on a virtual platform. And we encourage our team members, you as our service users, our partners, to learn more about the land you're on, to reflect on the enduring legacy of colonialism, and to think about meaningful reconciliation. There's a great website that is native-land.ca. And if you type in your address there, it'll actually tell you about what territory you're situated on, the treaties, and the languages. It's a great first step in learning more about whose land you're on. The work that non-Indigenous organizations and individuals need to do towards reconciliation with Indigenous peoples is a long-term journey. It is specific to each individual, and it's constantly evolving for us at FCO. But we appreciate the opportunity to work, learn, and live on these lands. And now back over to Melissa McVie from OARC for a few logistics. Melissa, you're muted.
Thank you. Before we turn things over to our special guests, we wanted to go over a few housekeeping announcements. Of course, you'll notice that you have no audio. You've been placed in listen-only mode, and this is to minimize any noise and distractions for our speakers. We have protected about 30 minutes today for a fulsome conversation and for some questions and answers. And at this time, you will be invited to use the question and answer box at the bottom of your screen to pose your questions to our special ministry guests. As Sam mentioned earlier, the chat feature will be disabled during the presentation to minimize any confusion around where to enter your questions. Today's session is being recorded, and it will be made available to our participants following our time together. And we will be posting our recording on our respective YouTube channels and websites for both Family Councils Ontario and the Ontario Association of Residents Councils.
Thank you. And now, for those who have missed perhaps our first moments, my name is Sam Peck. I'm the Executive Director of Family Councils of Ontario. And now, without any further ado, it is my sincere pleasure to introduce the first speaker this morning, Erin Hanna, Associate Deputy Minister, Long-Term Care Policy and Pandemic Response. Over to you, Erin.
Thank you so much, Sam and Melissa, and good morning to everyone who has joined us today. It's really fantastic to be here with you. I'm very excited about this webinar as another opportunity for us to share information and connect with residents and family members. This is something that we have started doing fairly recently, and I think has been really a great opportunity to be able to respond to the questions that people have and really identify and inform our path forward as we continue to provide additional supports and information to help people understand the transformation path that we're on with respect to long-term care. I also want to thank Family Councils Ontario and the Ontario Association of Residents Councils for co-hosting today's information session. Sam, Melissa, both of your organizations play such an invaluable role in supporting residents, families, caregivers, and we're so grateful for your ongoing partnership. I also just want to take a moment to acknowledge the words that Sam shared in terms of reflecting on reconciliation and the history in Canada and the journey that we are all collectively on in respect of reconciliation. Sam, you always provide such a thoughtful reflection for land acknowledgements, and it's very special to me. My grandmother hailed from Sagamok and was a residential school survivor herself, so thank you for that. We've heard a lot from residents, families, caregivers, and other partners about the kinds of changes that we need to make to really improve and shift the focus within long-term care so that we're doing the best job in supporting the well-being of residents who live in long-term care, who call long-term care home, and ensure that they get the care that they deserve, both today and in the future. I'm joined today by leaders from across the ministry. We have a number of expert leaders on the call who are going to be sharing important information with you about the new law that both Sam and Melissa mentioned, the Fixing Long-Term Care Act, that for the most part will take effect on Monday. The focus of our presentation today is really on what it means for you, and we'll be saving lots of time, as was noted, for your questions after the presentation. We're going to do our best to answer those questions today and get to as many folks as possible. I recognize that we do have a time limitation, and so we also will try to record those questions that we don't have an opportunity to address and look to provide follow-up information in that regard. Before we get started, I also want to assure you that we've been sharing information with home operators about the new and expanded expectations of them under the new law to enhance the quality of care and quality of life for residents. And that will be a continuous path for the ministry in sharing supports, information, tools to home operators so that they are able to successfully implement the new law. With that, I'm going to hand it over to Lori Coleman. Lori is the Director of the Long-Term Care Response Branch within the ministry. And without further ado, over to you, Lori.
Thanks very much, Erin. And good morning, everybody. A very warm welcome. I'm thrilled to be here today and looking forward to sharing information with you about the new law for long-term care and to talk a bit about what it means for you as residents, families, and caregivers. Again, my name's Lori Coleman. I work with the Ministry of Long-Term Care in the Response Branch and have been connecting over the past many months with partners across ministries within the sector as we've been developing legislation and regulation. And so I'm looking forward to sharing that information today. We're also going to pause at the end of my remarks to take a quick poll to better understand who's on the line with us today. And as Erin's mentioned, we're saving lots of time at the end to try to respond to your questions and answers. So we'll move, actually, I think we're already on the next slide. So today I wanted to talk about a few things. So again, I want to share important information about the new law for long-term care. and to talk about key parts of that law and what they mean for residents, families, and caregivers. And again, we want to encourage people to ask questions. I can already see there's questions coming into that Q&A section, so please keep them coming, because at the end, we'll work very hard to address as many of those as we can. And the ones we aren't able to respond to today, we'll look to circle back with responses in writing afterwards. We'll move to the next slide, please. So what's new? On Monday, there will be a new law for long-term care homes in Ontario. And that new law is called the Fixing Long-Term Care Act 2021. It includes a regulation that contains additional rules around how homes operate. It applies to all long-term care homes across Ontario, regardless of who owns or operates those homes. And most of the new rules and requirements will start on Monday, including changes to the Resident Bill of Rights. But some others will come into effect a little bit later, and we'll talk more about those as we move through the presentation today. Next slide, please. So you may be wondering why there's a new law for long-term care homes. And really, a new law was needed to make sure that residents experience the best quality of life, supported by high quality care. Changes were also needed because, as Melissa mentioned earlier, the old law had not been updated in over a decade. There was certainly a need to expand resident rights and improve the care and services that residents receive in long-term care homes. This also has provided us an opportunity to include the many lessons that have been learned throughout the COVID-19 pandemic. Next slide, please. So what's different in the new law? Well, in the Fixing Long-Term Care Act, there are enhanced requirements around staffing and care, protecting residents and expanding their rights, and making sure that residents can live in modern, safe, and comfortable homes. And those elements have formed part of a broader plan to fix long-term care. And really, the introduction of legislation is a cornerstone of that plan. The new law places greater emphasis on quality, which we'll speak about in a few minutes. Next slide, please. The Fixing Long-Term Care Act changes areas that we've heard are important to all of you on the call today. It makes changes to areas like resident well-being, resident safety, staffing, emergency planning, accountability, and quality. Next slide, please. And I'll highlight some of the key features of the new law now. The Fixing Long-Term Care Act expands resident rights, including the right for residents to have access to caregivers. For the first time, we have a definition of caregiver included in the law. The new law also establishes a system target to provide an average of 4 hours of direct care per resident per day by March 31st of 2025. And that includes care from personal support workers, registered nurses, or registered practical nurses. The new law also has requirements so that homes are better prepared to respond to emergencies, including outbreaks and pandemics. Next slide, please. The Fixing Long-Term Care Act includes stronger infection prevention and control requirements and has a greater focus on standards around quality of life and quality of care. It also introduces new tools to encourage homes to follow the rules and supports continuous quality improvement. In the next slide, I'll talk a little bit more about what the new law means for day-to-day lives of residents, families, and caregivers, starting with emergency planning. We'll move to the next slide, please. It is of utmost importance to ensure the safety of residents at all times, and especially during emergencies. The Fixing Long-Term Care Act will make sure that homes have emergency plans that prepare them to respond effectively to emergencies, including outbreaks and pandemics. Residence councils and family councils can expect more engagement and collaboration from homes on the development of those emergency plans. Homes will be required to develop emergency plans with input from residence councils and family councils. Homes will also be required to keep councils informed during an emergency and also when an emergency is over. And that will include a requirement to debrief residents and others in the home after an emergency. Homes are also going to need to make sure that staff, volunteers, and students will be trained on emergency plans. We'll move to the next slide, please. Under the new law, it will also require homes to provide residents with food and drinks during an emergency and ensure that residents can get their medication if there's a need for evacuation. Homes must also make sure that they have equipment that works during a power failure so that they're able to call for help if there is an emergency. And lastly, families and caregivers will benefit from the new law's requirement that homes post their emergency plans and other relevant information on a public website. We'll move on to the next slide now to focus a little bit more on resident safety. A key feature of the new law is stronger requirements around infection prevention and control, a key lesson from the COVID-19 pandemic. These new, stronger measures are important to help ensure the safety of residents in outbreak situations and otherwise. This means that all staff in homes will be required to be trained on infection prevention and control. And to take it one step further, all homes must make sure that there is a hand hygiene program in place for visitors in accordance with any standard or protocol that's issued by the ministry. Next slide, please. We've got a bit more on resident safety. And one of the things that we've heard very clearly is the importance of temperature control and cooling requirements in long-term care homes. To protect the health and safety of residents, the new law requires homes to ensure that air conditioning is available in resident bedrooms by June 22nd of 2022. Although there will be some limited exceptions that apply. If air conditioning isn't available in resident bedrooms, a home must clearly indicate this on the homepage of their website. And to help keep residents, families, and caregivers safe, there are enhanced screening measures for all staff, volunteers, and members of a home's governing structure for criminal wrongdoing and professional misconduct. Next slide, please. With regards to resident well-being, one of the biggest lessons learned from the COVID-19 pandemic was the importance of caregivers to resident well-being and the need to balance infection prevention priorities with the social and emotional needs of residents. We appreciate how challenging restrictions on visitation were for residents, families, and caregivers during the COVID-19 pandemic. The new law aims to prevent situations where residents do not have access to a caregiver. For the first time ever, the new law defines caregiver and makes them a type of essential visitor. All homes are required to have a visitor policy that respects the resident's Bill of Rights, which comes into effect on Monday and ensures that caregivers continue to have access to homes during an outbreak, subject to any restrictions of the Chief Medical Officer of Health. Homes will also be required to document when a resident or their substitute decision maker designates a family member, friend, or person of importance as their caregiver. Next slide, please. In addition to this, the new law takes a more holistic approach to understanding and addressing the needs of residents. Under the new law, palliative care options made available to residents must not be limited to end-of-life care. It must consider things more holistically. It must consider the physical, emotional, psychological, social, cultural, and spiritual needs of a resident. I can't stress enough that palliative care options are only provided with consent. And moving forward, the ministry will be working with the broader health sector to help homes access tools and resources for staff, residents, families, and caregivers to improve awareness about this shift in practice to a broader, more holistic approach to palliative care. Next slide, please. A bit more on resident well-being. Starting on July 11th of 2022, the new law, the Fixing Long-Term Care Act, will provide more flexibility in menu planning at the home level to increase choice for residents. Homes will be required to serve meals and snacks at times that are agreed upon by the Residents' Council and the administrator or the administrator's designate. Registered dietitians will be required to evaluate menus, and menus will no longer need to follow the Canada Food Guide, which is not recommended for the long-term care home population. And with these changes, residents will have food options that meet their needs and their preferences. We'll move to the next slide, please. Another key learning from the COVID-19 pandemic was how important medical leadership is in homes. The new law clarifies the roles and responsibilities of a home's medical director, as well as requiring that medical director to complete special training about providing care in long-term care homes. As part of their duties, medical directors will be required to develop, implement, monitor, and evaluate medical services in the home. As well, they'll need to review and approve clinical policies and procedures in a home. This was done to make sure that all residents receive appropriate and responsive care. Next slide, please. This brings me to the final topic I wanted to highlight: accountability and quality. I'm sure you may be wondering, how will homes be encouraged to respect the new law, and what happens if they don't? The new law expands requirements for how homes address complaints. If an individual complains about a home, the home will have to provide the person making the complaint with a few things. They'll have to provide them with the ministry's hotline number, the contact information of the patient ombudsman, and a notification that the complaint was forwarded to the ministry. The new law also expands protections for whistleblowers. It protects whistleblowers if they disclose information to a residence council or family council so that incidents can be reported without fear of retribution. Also, the new law implements administrative monetary penalties, an enforcement tool the ministry can use for homes that do not comply with the law to encourage them to comply with the law. Next slide, please. A key objective of the new law is to encourage broader culture change in homes to ensure that residents receive the best quality of life and quality of care possible. The new law will require each home to have a continuous quality improvement committee, and that committee will have representation from residents' council and family council if there is one. Homes will have 6 months to meet this requirement, so your home's quality improvement committee should be up and running by the fall. And each year, a home must prepare a report on its continuous quality improvement initiatives. To encourage transparency and accountability, a copy of that report must be provided to the Residence Council and the Family Council, as well as posted to the home's public website. We'll move to the next slide, please. The Fixing Long-Term Care Act is a significant milestone in the government's plan to fix long-term care, but we are very cognizant that our work does not stop here. The ministry will continue to keep residents, families, and caregivers informed and to listen to their concerns. It's one of the reasons we're here today. While it is ultimately the responsibility of homes to ensure that they comply with the new law, important work is already underway with homes to help them understand the new law. And later this year, the ministry will begin a new phase of regulation development and will be continuing to collaborate with stakeholders, including residents, families, and caregivers, to develop any future regulations so that homes operate to meet a single vision: that every long-term care resident in Ontario receives the best possible quality of life, supported by safe, high-quality care. That concludes my remarks for today. I know there's lots of information to digest here. It's great. I can see questions coming into the question and answer portion of this. And before we move to the question and answer portion, I'm going to pass it back to Sam because we would like to take a quick poll to understand who's with us today. So Sam, back to you.
Thank you so much, Laurie. As you've mentioned, there are a lot of questions that have come in. It's a testament to how deeply families and residents care about this topic and the future of long-term care homes in Ontario. Before we transition to our Q&A, we have a quick poll for you just to understand what your connection is to this topic today. So we invite you to go to this very simple poll with the question, how are you connected to long-term care? Options are, I'm a resident of a long-term care home. I am a family member or caregiver for a resident. I am involved with a family council for a long-term care home. I am a long-term care home administrator or staff member, and other general interest. Note that you can select multiple responses. It is multiple choice. So if you, for example, are a family member of a resident and a family council member, you can choose that option as well. Also feel free that if you're a residence council member to choose the third option of being a council member. We're going to give just a little bit more time, a couple seconds. I see that well over half of you have submitted your response to the poll. Now over 72%. As of right now, we've got most folks joining being family members or caregivers of a resident of a long-term care home. It's well over 56% of you, with also many family council members, long-term care home staff, which we pleased in that you'll be able to pass this information along to your families and residents. And we're going to give it about another 5 seconds for you to respond before we end the poll. Okay, and ending the poll now. So I'm going to share the results with you. So most folks, as I said, are family members or caregivers, many home staff, a good number of residents, which we are always pleased to see. So thank you very much for responding. This helps us to get a better understanding of where these questions might be coming from, but also for planning future joint events with OARC. It's always very helpful. Okay, and now I will turn it back over to the ministry team to proceed to our very active Q&A section.
That's great. Thanks very much, Sam. So this is wonderful to see. We've got lots of questions coming into the Q&A. So we won't get to them all today, but we'll do our very best to get to as many as we can. For the first question, I'm going to pass it over to Kelsey Gershon. The question is, what are the changes that have been made to the Resident Bill of Rights, and how are families covered by this? I'm going to pass it over to you, Kelsey.
Thank you very much, Lori. And thank you very much for the question. That the Bill of Rights is a very important part of the existing Long-Term Care Homes Act, and is, of course, a very important part of the new Fixing Long-Term Care Homes Act. The Residents' Bill of Rights has been updated and changed in response to recommendations from a lot of third-party recommendations, including the COVID-19 Commission. In that report, in the COVID-19 Commission, it was recommended that the language in the Residents' Bill of Rights to be updated to more closely align with the grounds of discrimination in the Ontario Human Rights Code. So that change has been made. In addition, the Bill of Rights was expanded by adding 2 new residents' rights. The first one is the right to ongoing and safe support from their caregivers and assistance in contacting those caregivers. As well, every resident has the right to be provided with care and services based on a palliative care philosophy. Finally, in the new legislation, to make it easier for residents, their families, and caregivers to understand and follow the Residents' Bill of Rights, it has been updated to include and reorganized to include the addition of subheadings.
That's great. Thank you so much, Kelsey. All right, I'm going to move on to the next question. There's been a few come through the Q&A portion. With respect to questions about residents having access to their unvaccinated caregivers, and what are the rules and do they change with the new act? And I'm going to ask Dawn Mallett to respond to this question. Dawn?
Hi, Lori. Thank you. And thank you, everybody, for joining us today. I'm Dawn Mallett, a Director of Pandemic Response here at the Ministry of Long-Term Care. So a great question about vaccinations. In March, early March, the ministry announced that we were ending our minister's directive on the immunization policy. And so that was the directive which required all long-term care homes to have a policy in place with regards to people coming into the home and their vaccination status. And that included requirements regarding visitors and caregivers and the amount of vaccinations that they were required to have. So that requirement from the ministry level did end on March 14th. And at that time, we asked homes to take a look at their vaccination policy and make a decision as to whether or not they wanted to keep one. With making that decision, we very much encouraged looking at the public health measures within their communities, as well as ensuring to engage with the resident council and the family council and the local public health unit as well when looking at what the requirements should be. I think best next steps, if you do have questions about what the home's immunization or vaccination policy is, would be to speak to the home itself. And just to hit on the last part, there's no changes to this per the new regulation and legislation that has come in. Thank you.
Thanks very much for that, Dawn. We're going to move on to the next. There's a number of questions that relate to staffing, which is such a critical component in long-term care homes. So the questions are centering around the average hours of care, and specifically, what is the province doing to increase the number of nursing and PSW staff? And with that question, I'm going to ask Adi Ibarguchi to respond.
Thank you, Lori, and hi, everyone. I'm Adi Ibarguchi. I'm one of the Assistant Deputy Ministers at the Ministry of Long-Term Care, and I did see a lot of interest and a lot of great questions on staffing, and I'll try to touch on as many as I can, and as was said earlier, we will take some of these away and respond if we don't get through all of them. So as Lori, when she was walking through the presentation, talked about, the new legislation does set out a target that will have annual targets for resident care increasing to 4 hours of care by 2025. And it also includes targets that's specifically in relation to direct care provided by nurses and PSWs. There are also additional targets related to care provided by allied health professionals. So the two targets there was a question about whether there are investments related to the new requirements in legislation. And this is an area where there are significant investments that the government has started making. Last year, $270 million were provided to long-term care homes to very immediately begin increasing direct care for residents. In alignment with those targets. This year, the government will be investing $670 million to increase hours of care and move towards those increased targets. And good questions as well around what does that translate into in terms of new staff and new PSWs and nurses that long-term care homes will need to hire. And so the province is projecting that through these investments and increases in hours of care, the long-term care sector will have 27,000 new PSW and nursing positions to fill. And that has already started, as I mentioned, with the investments last year. Many questions came in related to and touching on the point that that in some cases has been and will be challenging for homes when they are not able to find staff and also competing with other healthcare sectors and frankly other sectors that also employ nurses and PSWs, for example. So in many of the investments that have been made over the last year and that are continuing this coming year, there has been a strong emphasis on really increasing the opportunities for individuals that would like to attend colleges and universities to become PSWs and nurses. So lots of expansion and acceleration to really increase that number of individuals that will be available for long-term care homes to hire, as well as other healthcare settings. And some of those are looking at new ways of, for example, where there are internationally educated nurses already working in long-term care homes, those opportunities to pursue the ability to become a registered nurse in Ontario, and some other kind of bridging and laddering programs. So lots of initiatives to support the increase overall to be able to meet these increased hours of care that can be provided to residents that are already underway. There was a question I'll just touch on. Sorry, Lori, I'm trying to touch on a number that came up that asked about whether we work closely as a ministry with the Ministry of Education, was the specific question, in auditing the programs for staff that are trained. We do work very closely with the Ministry of Colleges and Universities, who have very concrete criteria for programs that have to be met if a college or university is offering a PSW or nursing program. We also work very closely with other partners like the College of Nurses and so on. So that's more on the nursing side. But the Act itself, to bring it back to the Act and regulations, in the current Act and in the new Fixing Long-Term Care Homes Act, or the new Fixing Long-Term Care Act and regulation, there are some very specific criteria that individuals hired as PSWs have to meet. Numbers of hours that they've spent in training and education, etc. So there is some criteria there. And I also noticed there's a question about PSW oversight and regulation in the province. And that is something that the province is also working towards with new legislation that was passed last year. That will provide a new oversight of PSWs in the province. So we can provide a bit more information when we circle back on these. Last piece I'm going to touch on, because there were a number of questions around it, is an average system average level of care in terms of the targets of direct care for residents. However, the ministry is looking very closely at the data from each home and the level of hours of care that are being provided, and analyzing those on a quarterly basis. So it is something we're going to be monitoring, and in the coming months and in the fall, we are planning to do a lot more work and engagement, and we hope to do that as well with residents, resident councils, and families around further staffing questions like staffing mix and ratio, which ties into hours of care. And there was a question about that. And so while we currently don't regulate staffing ratios and mix, and we know there are unique things we need to look at, that is the work we want to do with the goal of providing guidance to long-term care homes. So it's the hours of care, but it's also the staffing model and mix that we want to make sure is supporting the residents' needs in the most meaningful way based on those unique needs. So that work is to come, and we hope to engage on it further. I'm going to stop there.
Thanks very much, Addie. We may be back to you. I think there's still some questions around staffing, but for right now, we've also received quite a few questions about cohorting of staff and residents when a home is in an outbreak. And the question really is, what are the rules around that? And so I'm going to call again on Dawn Mallett to respond to that question.
Thank you, Lori. Yeah, so it's an excellent question. I think we can all recognize the importance of cohorting as one IPAC measure to be in place, especially when a home is in outbreak, to try to stop the transmission of COVID-19 throughout the homes. What cohorting within each home looks like, it might vary, because we need to recognize that there's over 600 homes in the province, and every home has a different setup and layout. And so an important part about, especially when a home is in outbreak, is that the public health unit is involved. The home is working very closely with the public health unit whenever there are outbreak measures that need to be put in place. And so while the ministry can't say, you know, here's all the different rules, here's what cohorting needs to look like, the public health unit should be very involved. They're very much have a good level of expertise on IPAC in making sure that what cohorting looks like makes sense for that home, given the layout, given the operational needs, and making sure, you know, at the end of the day, the most important part is that the residents are receiving the proper care, and again, stopping the transmission of COVID-19. And so really, if you have concerns about cohorting within your home, either for the residents or the staff member, again, strongly encouraged to speaking to the home and bringing those questions forward, where they would be better suited to answer why things might look different than what you would expect there. Thank you.
Thanks for that, Dawn. That was helpful. Again, we're still receiving questions in, so we're going to try and get to as many as we can. So for the next question, we've got someone who's inquiring about what happens when a home doesn't follow the rules. What are the consequences, and can it result in the revocation of a license? And so I'm going to invite Kelsey Gershon back to respond to that one.
Hi, thank you, Lori. I really appreciate the question, and appreciate there are some concerns with non-compliance, and particularly repeat non-compliance by some licensees in the operation of a home. And that is why the Fixing Long-Term Care Home Act includes new and strengthened enforcement measures to address non-compliance in a long-term care home. So this is all part of our inspection process. So it focuses on ensuring that licensees comply with Fixing Long-Term Care Homes Act in order to promote and protect quality of life and quality of care for all residents in the long-term care home. When an inspector goes into a home, or a director goes into a home and finds non-compliance, they take into account both the scope and severity of the non-compliance, the compliance history of the licensee, and then they use that information to determine the appropriate compliance actions that need to be taken. So the new compliance and enforcement regime under the Fixing Long-Term Care Home Act was developed using modern regulatory principles and includes a broad range and escalating enforcement procedures that respond to specific instances of non-compliance. So unlike the previous Long-Term Care Homes Act, there is no longer a voluntary plan of action, which was a compliance tool that was previously used, in which an inspector would issue a voluntary compliance action for the home, but did not require follow-up. So we've removed that and added some additional compliance enforcement tools, including remedied non-compliance. So this is a compliance tool that provides a way for inspectors to address very low-risk compliance and compliance issues that can be remedied on the spot. We've also included, which has existed previously, written notification, so a requirement that inspector inform the licensee that they are in non-compliance. And then we've updated our compliance orders to include orders such as required training, or to do anything, or to stop to do anything in order to comply with the legislation. And those all require and would be followed up upon. In addition, there's a new tool, enforcement tool called administrative monetary penalties. This is monetary penalties issued to licensees for repeat non-compliance. And we have updated the grounds by which a temporary manager can be required to help run the home, either in totality or part of the long-term care homes, if it's identified that there are issues that the licensee requires assistance with. We've also increased fines for offenses under the Fixing Long-Term Care Home Act. Those have been doubled, and we're improving our capacity to investigate and if it's appropriate to lay charges under the Long-Term Care Home Act. And finally, getting to the question, we do have the ability to suspend a license if it is found that the home is not being run in a manner that is that is not respecting the care and safety of the residents. The license can be suspended and a supervisor can be appointed. In addition, and finally, a license can be revoked. It can be removed altogether, and the licensee would no longer be able to operate that home as well.
Thanks very much, Kelsey. All right, for the next question, will screening of staff be required for existing staff and any agency staff used by long-term care homes? And for that question, I'm going to invite Anita Hooper to join us.
Thank you, Lori. And I'm Anita Hooper from the Ministry of Long-Term Care's Operational Policy and Implementation Branch. And yes, the screening is required of staff. This is not new to the new regulation and legislation. This it carries over from the previous act. What is new is that staff must attest to the screening on a regular basis, so that it's not just done once. Agency staff are not, they don't have to comply with this as they are not staff of the homes. However, for registered nurses and RPNs and physicians, they all have to do that screening as part of their colleges. So that the screening would have been done, they just wouldn't be attesting on a regular basis like the home staff would need to. What is new in the regulation and legislation is that board members or the oversight of the home, they are now required to have a police record check. So that is new in our new Fixing Long-Term Care Homes Act. Thank you, Lori.
Thanks, Anita. I'm not surprised that we've got some questions about menu planning. And what are the changes being made to menu planning? There's been a few questions about funding with that respect. So is there going to be more funding to meet demand for menu choices and culturally appropriate food? And so Kelsey, I'm going to invite you back to the mic.
Thank you, Lori, and my apologies. I should have introduced myself the first time. My name is Kelsey Gerson, and I'm the Director of the Policy and Modernization Branch in the Policy Division at the Ministry of Long-Term Care. And while I can speak to the changes that are will be happening as a result of the amendments to the new Fixing Long-Term Care Home Acts and the regulation, So the Fixing Long-Term Care Home Act will provide more flexibility in menu planning. So this will help both increase choice for residents regarding when and what they want to eat. And we also hope this will reduce food waste, because we've heard from residents and family members that food waste is of a concern as well. So the menu planning cycle will provide a minimum now 1 entree and accompanying side dish at all 3 meals, with other available entrees, side dishes, and desserts to meet the residents' specific needs and preferences. Meals will be served at a time that's agreed upon by the resident council and the home's administrator. So now that time, the residents will have more say into when meals and snacks are served. Menus will also provide a variety of food, including fresh produce and local foods in season. And of course, a menu plan is required to be evaluated by a nutritional manager and a registered dietitian. As Lori mentioned at the top of the presentation, the reference to the Canada Food Guide was removed because it was determined that this was not an appropriate guideline for the demographic in long-term care homes. But the nutritional manager and registered dietitian will need to make sure that the nutritional adequacy is up to par based on dietary reference intake. So that's relevant to the resident population. I can't speak to specifically to changes in funding, as these are just changes in legislation and regulation, and I don't believe that there's any funding changes, but I will have to get back to you specifically on that.
Thanks very much, Kelsey. Addie, we're going to cycle back to you for a question about the promised increased pay for PSWs due to COVID, and has that been given, and was it retroactive?
Thanks, Lori. So there was a pandemic pay some time ago that was provided to many, including PSWs, and was retroactive to the start of that. Also, since October of 2020, there has also been specifically increased temporary wage enhancement for PSWs, for long-term care home PSWs specifically. That was a $3 an hour increase, and it has been implemented and has been provided to PSWs since that time. And the government recently announced the intent to make that permanent going forward. So there has been legislation that has been introduced in the House with the intent that that will be made permanent for PSWs in long-term care, as well as in other settings.
All right, that's great. Thank you, Addie. Next question, who is the medical director in long-term care and what's their role? And for that, I'm going to invite Anita back.
Okay, thanks, Lori. So the medical director they're a physician by training, and they can't be the licensee of the home. But what their role is in the home, it's an oversight or administrative role. So they advise the home leadership on medical issues. They work with attending physicians in the home and nurse practitioners. We have some new requirements in the regulation that requires that all medical directors complete a training course offered by the Ontario Long-Term Care Clinicians. So it's a specific medical director course. And they are required to participate in the Infection Prevention and Control Interdisciplinary Committee. So they need to be engaged in that IPAC work for the home and have some additional oversight over care practices, medical care practices in the home as well.
Thanks, Anita. Thanks very much. I'm going to turn it back to Kelsey for questions that relate to the Bill of Rights again. So Kelsey, will homes need to post the new Bill of Rights and circulate it to residents, families, and staff? And when does that need to be done by?
Thank you, Lori. Yes, it's imperative that homes post the Bill of Rights. That is a requirement under the legislation and the regulation, and circulate it to provide information to residents. I don't know that I have the answer on the tip of my head as to when this was, by when this needs to be done by, and I don't want to misspeak. So let me get back to you on that one.
Yeah, that's no problem. Thanks, Kelsey, but don't go too far because our next question is about palliative care. So the question is, what does palliative care consist of? And what does it mean if it's applied, yet the resident's death isn't expected to be immediate? So can you talk to us a little bit more about palliative care?
Yeah, so the new regulation includes, the new legislation includes a new residence right that every resident has the right to be provided with care and services under a palliative care philosophy. This palliative care philosophy, I think it's important to note, is not limited to end-of-life care. It aligns with the Ontario Palliative Care Framework, which was tabled in the legislature at the end of December in 2021. And in that palliative care philosophy, it speaks about relieving suffering and symptom management and improving quality of life for all persons suffering with a serious illness. So palliative care philosophy brings in a much more holistic view of palliative care. And so it certainly does not necessarily mean that a resident is near end of life. The Act requires that every resident ensure that a plan of care covers all aspects of care, including palliative care. And so an interdisciplinary assessment of a resident will include considering the resident's physical, emotional, psychological, social, cultural, and spiritual needs. Based on those needs, a palliative care options will be presented to the resident and their family or caregivers, their substitute decision maker if appropriate. And those options need to include at a minimum quality of life improvements, symptom management, psychosocial supports, and end-of-life care if that's appropriate for that particular resident. But of course, as always, before taking on any assessment of the resident's need or providing care or services to a resident, the licensee needs to ensure that a resident's consent is received. Palliative care will be provided only if it's appropriate and within the needs of the residents. And of course, the Act also increases aligns the training requirements for direct care staff to align with this new, more holistic view of palliative care, and it removes the training exemptions that previously existed for medical directors and physicians. So we're really trying to implement a culture change and an understanding of what palliative care means, to broaden it to ensure that it really helps improve quality of life for as many residents as is applicable.
Thanks so much, Kelsey. The hour has flown by. I have to say, I'm so excited. We've just hit 200 questions in. So we've got some takeaways and some homework to do. You have our commitment that we'll be working to prepare responses to all of the questions that we've received. And we'll be sharing those responses with Family Councils Ontario and the Ontario Association of Residents Councils to make sure that they get back to you. I wanted to take just a very quick moment to thank you all for attending. Thank you for your engagement in this. It's really been wonderful, and a special thanks to our partners at Family Councils Ontario and Ontario Association of Residents Councils for their support in pulling this event together today. It's been my pleasure to be here, and with that, I'm going to turn it back to Sam and Melissa.
Thanks so much, Lori. We just wanted to echo those words of thanks to you on behalf of both Family Councils Ontario and OARC, and really to thank our exemplary panel of ministry guests today. I know our audience really appreciates these opportunities to stay informed and to really be part of moving forward with this new legislation that really will directly impact and influence their lived experience as residents and as care partners and team members working in long-term care. And I just wanted to highlight that we did have this special opportunity to spend time with our Associate Deputy Minister of the Long-Term Care Pandemic Response, the ADM of Long-Term Care Policy, as well as a number of directors representing different areas of government. And this is very special to also put faces to names and to see the people in the team and all the hard work that's going on in the back end that residents and families don't often get to see. So thank you. And I know there were a number of questions that came through about whether our session will be recorded. Yes, it was recorded, and we look forward to circulating the recording as well as the accompanying slide deck to our audience and those who perhaps didn't have the chance to join us live today. I know our session filled up quite quickly, which I knew Sam acknowledged earlier, that this is really a testament to the interest in being part of solutions and the culture change as we move forward with new legislation for our sector. So thank you.
Thank you so much, Melissa, for those closing remarks. And just to echo a big thank you to our presenters and panelists, to everyone who joined us this morning. Our session did fill up quite quickly, but the recording, as Melissa said, will be made available in the coming days. I want to thank you again for both on the ministry side and our attendee side for your commitment to discussing this important topic, this big change in our long-term care sector. So on that note, our time this morning has come to a close. On behalf of Family Councils Ontario, OARC, and our Ministry of Long-Term Care colleagues, thank you so much. Stay safe, take care, and we'll be in touch with any new developments in the long-term care sector. Thank you, everyone.
Thank you.